All right. Good morning, everyone. I am Jennifer Slattery with the League of Cities and Towns. I coordinate these Workshop Wednesday program. And today we're excited to host our friends from Blue Cross Blue Shield of Rhode Island. I am going to turn it over to you, Mark, and allow you to kick it off and introduce any of your team members. But I appreciate you being here today. Thanks.
Awesome. Thank you very much, Jennifer. Good morning, everyone. My name is Mark Thomas. I'm part of Blue Cross Blue Shield of Rhode Island, and specifically the group Medicare account executive. So I see some familiar faces on the call today, so great to see you again. And before I get started, I do want to introduce Maddie Smith, who is my sidekick in the group Medicare space. She's our account manager. So if you haven't met her yet, she is another resource when it comes to any post-retirement benefits that you administer to your retirees. Between myself and Maddie, more than happy to answer any questions today, tomorrow, 6 months down the road, whatever it is. Please feel free. And actually, I'll probably put I always do this in the beginning, at the end as well. I'll put my contact information, so I'll give my direct line as well as my email address. So, if you have questions, obviously today, as we're discussing things, please, chime in. I know Jen has volunteered to kind of keep track of the chat. And if anything comes up, please feel free to jump in. So actually, before I forget, let me just put my contact information. I'll put my email address that way. Don't forget later. And actually, Maddie, if you want to do the same thing too, if you want to throw in your information in the chat, that way everyone has it. Okay. So the basis for our conversation today is obviously Medicare, and what I want to do is not just jump right into plan offerings, benefits, but what I want to do is build a foundation, because everyone's understanding of Medicare is different. Everyone's experience with Medicare is different. So we're going to literally start with the ABCs of Medicare, use that as a foundation piece, and then build off of that to bring it back to you amongst the towns and cities, and how your post-retirement offerings, what you maybe currently offer, and some of the things that are now in the marketplace, what we're seeing, and then also potentially what you could be offering to your retirees. So let me pull up the presentation. Oops, hold on a second. I don't know why it's. There we go. There we go. Okay. Jen, can you see my screen? Just want to make sure before we get started. Okay, great. So as I said, Medicare is obviously, for most people, you're used to dealing with active commercial populations. So they make their elections every fall. They select, they go into effect for the following year, you put it aside. And so that's both for town and city members, employees, that's what you're used to during your active working days. Then all of a sudden you hit what's called Medicare, and you say, what is that? What do I have to do? I don't want to I heard there's penalties, there's all these things that kind of come about. And so the basis, what we want to get into today is the understanding of Medicare and where it's driving towards. So, as we talk about different terms, a lot of people the term Medicare supplement might resonate with them. And that's basically what's been around since 1970s. And when they established Medicare, is the ability to buy what's called a Medicare supplement. Today, in today's Medicare marketplace, the Medicare supplement is actually slowly declining, and we're seeing a continuous growth in what's called Medicare Advantage. And we're going to go over the differences between the two. But I want to just bring to your attention what we see. So from our end, since the early 2013, we see a double-digit increase in growth of the MA plans during that time up until today. In fact, I believe it's 40 8% of all Medicare eligible members that live in Rhode Island are enrolled in an MA plan. And so I think on a national level, that's about 42%. So here in Rhode Island, the Medicare Advantage plans are showing quite a bit of growth. And that lends itself to, we look at other statistics and things of why is that? So a lot of people are used to the Medicare supplement where they get their medical and prescription. But some surveys are showing that a good portion of these people are saying they really are attracted to the additional benefits. And we'll get into greater detail on what that means above and beyond maybe what they currently have today. So starting with the initial foundation of what is Medicare and basically how does one step in and enroll in Medicare? So if you yourself, you're working for a town or city, you're working with your employees on a daily basis, they come to you, and I know for a fact a lot of HR staffs, they're overwhelmed, they're understaffed, and they're trying to get things done, just helping their active population, never mind the retirees or the ones that are about to go into. And they go to them looking for, hey, how do I set up my Medicare? What do I do? Who do I contact? So just some quick, FYIs. So obviously you need to be 65. So some of your retirees may hit 60, retire before 65. They would not be eligible to enroll in either a Medicare supplement or Medicare Advantage plan. They would have to go on some other type of coverage. Then once they hit their 65th birthday, that creates what's called a life-changing situation, and basically activates or enables them to enroll in an MA or in a Medicare supplement plan. So when they hit that 65th birthday, they actually have a 7-month window. So you get 3 months prior. So for instance, my birthday's in June. So if I was looking to, activate my Medicare, I would have the 3 months prior. So May, April, March. So those 3 months, the month of my birthday, and then 3 months after. So July, August, September. What that does is it provides a window of opportunity for you as the individual to make your election. So even if you're 65, I want to make an important point here. If you're turning 65, my recommendation is if you're going to work past 65, that you still contact your local Social Security office and let them know I'm going to continue working and I have, credible coverage working for my employer. And then when I go to retire, I will come back. And so there's Medicare Part A and B. Medicare Part A is something that you paid for in advance. If you ever look at your paycheck and you see a line item called FICA tax, the FICA tax actually pays for your Part A enrollment into Medicare ahead of time. It's actually 10 years of paying this tax that goes for. So you're prepaying your Medicare Part A. So when you do call in that 7-month window, whether you're going to elect both A and B, or you're going to continue working, A, you can sign up for. Because you're not paying for it, you've already prepaid for it, you can absolutely elect a Medicare Part A. I would like to know one thing. If you're on a plan that has an HSA, if you enroll in Medicare Part A or B, that does affect your ability to enroll or invest in your HSA. Basically, the rule is if you have an HSA plan and you're going to be enrolling in Medicare, they ask that you stop contributing to your HSA 6 months prior. So if you are working, you're on an HSA, you're going to continue working past, then you would want to defer on both Medicare Part A and B. But if you're not an HSA sponsored plan and you're just in any other plan, you can certainly go ahead and enroll in Medicare Part A. The Part B, it's a little bit more confusing, and this is what people have a lot of questions on. So Part A deals with hospitalization. Part B specifically deals with doctors, specialists, things of that nature it covers. And that's Part B is assessed at a monthly premium. And so basically, if you do hit your 65th birthday, you are going to continue to work and you have credible coverage through your employer. There's really no need for you to enroll in Medicare Part B because you have the credible coverage in place. So basically, the Part B premium would be paid and you're not receiving any extra benefits, insurance, if there's nothing additional you get out of it. So you might as well. So at that time, you would defer on Medicare Part B. So that's one path. The other path is if you are actually retired or you are retiring in your 65th birthday, you would elect your both Medicare Part A and B at that time. And that builds the foundation to enable whether you're looking into a group sponsored plan or an individual Medicare plan. Anybody that's 65 and that's looking to enroll in a Medicare supplement or Medicare Advantage plan, you need both A and B established. And so the next question is, well, how do I do that? How do I get my A and B established? There's a few different options. You can go online, actually download the application, and you submit the paperwork, and it goes off for request. You can call your local Social Security office. There's several in Rhode Island, for instance, Middletown, Providence, Warwick, and I believe there's one up in Woonsocket, Pawtucket area. And each, I would say, coming out of COVID, their program or their engagement on how they want to do it. Some, I recommend calling ahead of time and asking, hey, I'm looking to get my A and B established for this September. And some will say, we're going to set up a phone interview with you. And others, they'll say, please come in and we'll do it, in person. So there's a number of different ways that you can engage, but it's through your Social Security department. And then also, like I said, you can go online and request for Medicare Part A and B to establish. So now once you've requested that, you have your Medicare Part A and B. So now you've set the foundation for the next step. So your initial relationship, or one of the relationships you have, is with Medicare and your Social Security office. And then the other relationship is now understanding, specifically if it's a Blue Cross offering, the different types of offering and what that means for you as an individual. And there's two different types of coverages in the Medicare space. One I had mentioned was the Medicare supplement. So on the left-hand side, left column, that's what we call original Medicare with options. On the right side, it's Medicare Advantage, or what we call Part C. The Medicare supplement, the way that works is it takes, you've enrolled in A and B, and then through Blue Cross, we have it called, it's a Medicare supplement or a Medigap plan, but we call it Plan 65. So use an example, you go to your doctor's office and you're in a Medicare supplement plan. You would hand them your Medicare card, which is that red, white, and blue card. It's going to have your name, your new MBI or your Medicare number, and it's going to show Part A and Part B and the effective dates. And so you're going to hand that to the receptionist, and then they're going to give that back to you. And then you're also going to give them the Plan 65. And that's how Medicare supplement works. So both Medicare is involved and Blue Cross or the provider to complete the total claims. And I'll go into a little bit more detail in the next slide. So you have your Medicare, you have your A and B, you have your Medigap plan, and then you also need some type of Medicare Part D or drug coverage. And those can be individual plans. Those can also be group offerings. I know some of the towns and cities in Rhode Island do have contractual obligations to provide both medical and prescription. But whether you're on an individual plan and getting it on your own or through an employer-sponsored plan, you do need to have your medical, and you also need to have a Part D plan. There's no getting around that. So you can go certainly out on the marketplace to look for a Medicare, a standalone prescription plan to go with that. So that's the Medicare supplement. The Medicare Advantage takes the elements of A and B, so your coverage for hospital, doctors, specialists, things like that, and it combines your Part D, and then it brings in what we call supplemental benefits. And so there's some others, but dental, OTC, gym, and we'll certainly look at those in a little bit. But it pulls it all together and simplifies it, meaning, you're taking all those elements in the individual kind of standard Medicare supplement, and it's pulling it all in one. I like to use the metaphor, imagine you're going to, stop by, you're grabbing some food and you're going through like a drive-through line at, say, Wendy's, for instance. So the Medicare supplement option would be, oh, great, they have a dollar menu and I want to go grab a burger and a drink and a French fry and something else. And you pull your meal together and you're happy with that. but everything's individualized. You had to go kind of pick it out. But then the Medicare Advantage, the way that works is you see the board and they have 7 different options of burgers and chicken sandwiches, but it comes with the French fries and the drinks, and they've already, that restaurant has already provided you with the meal itself. So you don't have to make the individual choices, and it comes out to you as one whole. So they both work effectively. It's just the manner and structure in the way they work. So as I was kind of alluding to previous, I was saying on the left side here, you'll see what's called the Medicare supplement structure. As I talked about with going into the doctor's office, you hand them your Medicare card. Medicare is responsible to pay the first 80% of the claim. And then the Medigap plan, or that Plan 65 card that you would be handing to the receptionist, Blue Cross comes in and pays the additional 20% to cover the claim. On the Medicare Advantage side, Medicare no longer is involved in paying of claims. We as the provider, so Blue Cross or any provider out there that's offering Medicare Advantage plans, we insure the member at 100%. The federal government actually, based on a formula that they use on individual members, we are subsidized back to provide that money to pay for claims, to pay for pay down premiums, to offer additional benefits, lower out-of-pocket copays. And so that structure is solely based on us, the Blue Cross, paying for those claims. Medicare now is taking a back seat and basically letting Blue Cross or the provider be the primary payer and insurer of each individual member. So now we have the structure in place, the elements of Medicare, what needs to be done, and the different types of Medicare plans. Now, how do we turn that into, how is that applicable on your day-to-day basis? You know, what you're looking at, you're dealing with active employees, retirees that are calling in, things of that nature, where we can come in and assist you and kind of be like an extension of your HR staff. What we work on, and you know, we've worked with several towns and cities, like town of Johnston, for instance, their school and their town retirees actually moved over to a Medicare Advantage. And I'll use them as an example. We, provided Medicare 101s. So whether it's an actual install of a plan, or if you're even just looking for myself and Maddie to come on with, your employees to give them some type of education, we can be your direct line into Medicare, certified knowledge. Don't feel like you're the one that's responsible to come up with all the Medicare answers, as they come in with questions to your office. So we provide that. We provide the education. We also, any members' fairs, any enrollment presentations. So a lot of times each, fall, there's an annual enrollment period where members have the ability to make a change from October 15th to December 7th. So we're actively, working with a lot of the towns and cities to help them educate their members so they can make the right decisions. So that doesn't fall on you. You can certainly rely on us to be that educator in that case. And then the last bullet I want to address is, so most people think everything is group billed, everything is sent to my office, and then if we pay X% and then we've got to bill out for the other percent the members paying, and it creates a lot of administrative responsibility. We actually have now a couple of different billing options. It's not just a group bill anymore. We actually have a direct bill, and we also do a split billing. So if you offered a plan, and we offer these plans too, you have no retirement benefit offerings. We do both Health Mate and Blue Chip, and we can actually direct bill the member. The town of Westerly actually set this up for their retirees, that they set up a direct bill subgroup that enables their retirees who don't have access only to the individual products to access a group sponsored plan. So you as the town or city would be considered the sponsor to the plan. And then the member would have access to that upon retirement, or if they're already in retirement, they can have access to it. Spouses as well. So it's up to the employer group, but they can set if spouses are allowed. And what that means is they would enroll in the plan. And then instead of the invoice coming to your office and you having to deal with it, it gets sent directly to the member's house and they pay Blue Cross directly. And there's no financial responsibility from the employer itself, as far as if they don't pay any premium, if they miss payment, that's on the member, that's not on the group sponsoring it. So there's no financial like liability from you, from the employer perspective. And then the other option that we have is split billing. And so I think that's another key administrative lever to pull, is that you can still get a group bill and you pay your percentage or dollar amount per member. And then we can actually go bill your individual members. If you said the premium's $100 and you pay 75 of that and you want the member to pay 25, we can bill you for the 75 and bill the member at 25. So it creates some, or lessens the administrative responsibility in that space of you having to retrieve premium from the member and then paying Blue Cross. It's now just up to you to pay what the employer, you as the employer, are responsible for. So not only are we providing assistance kind of on the front end, educating your members, working with you to come up with ways that we could help improve your administrative responsibility, and create some more downtime for you to put towards other things, because obviously we know as a staff, you're going 12 different directions. And so if we can take something off your plate in the Medicare space and retirement, post-retirement benefits, not only are we going to do that there, but we as an organization have been rated the last 2 years. So 2022 and this year, 2023, CMS has given us the 5-star rating. And this is on a scale of 1 to 5. And so we are the highest rated Medicare provider in the state. And we are very proud of that. And not only in the plan structures and what we offer is at 5-star, but also in our service, and specifically our concierge, which I'll get into our support team shortly. But basically, what that 5-star, what does that mean for you? It provides us with additional ability to enhance benefits, create lower out-of-pocket costs, and just overall peace of mind that we're controlling and facilitating these plans for your retirees, and overall just support from, like I said, the front end to the back end and everything in between. And so we look to continue this 5-star rating, not only last year and this year, but moving forward too, which would greatly help you from an administrative perspective, but then also your retirees. When we go back to talking about structures, Medicare supplement, we're kind of using the example of everything is individualized. So on the bottom row, that would be what's called our Group Plan 65 and a Blue Medicare X, which some of you are familiar with if you're offering prescription coverage. So like I said, you go into the doctor's office, you're carrying your Medicare card, your Plan 65 card for your medical, your prescription, if that person has dental, vision. So for every type of coverage, they're walking around. So minimum, you probably have 3 cards, potentially you could have 4 or 5, which, that system works, but it's obviously you're carrying around a lot more. The nice part about these Medicare Advantage plans from a structure and operational usage perspective is the idea that everything is captured under one card. So you go to that doctor's office, you no longer need to carry around your Medicare card. You can keep that at home. Blue Cross card will be given to the doctor for their medical. You leave there and you get a prescription. You go to your local CVS or pharmacy that you're picking up your prescriptions. You hand them the same card. If there's dental embedded, you'd use the same card. So overall, it's just a very simplistic experience for the member when they're on a Medicare Advantage, as far as just maintaining one card, which they're coming off of a commercial plan where they probably had one card as well. So they're maintaining that simplicity of use. Then we just get into the overall coverage for these plans. And when we look at Medicare Advantage, Rhode Island, we have a very, very strong network, both for our doctors and our dentists. And so a lot of your retirement benefits are both medical then the prescription, and then another key component is the dental offering for some of these plans. So locally, we have a great network, but now we also have a great network across the nation. And this is new as of 2020. So in the past, many of you established what's called a blue chip for Medicare, HMO POS. And that's great for your in-state retirees. Problem is, a lot of your towns and cities, a lot of your folks are, getting up, leaving, going to Florida, California, the Carolinas. And so in 2020, we came out with the HealthMate Coast to Coast PPO plan. And that works in the manner like Plan 65, meaning it allows you as a retiree to live anywhere in the US, does not mandate that you live in Rhode Island. So any of your members that are on Blue Chip, they're required to be Rhode Island residents. The PPO plan that we now offer provides the national coverage, but also the ability to live anywhere across the US. So then from a local support perspective, what are we doing and how are we engaging your members? How can we assist you from an administration perspective? So currently, we have 4 Blue stores: Lincoln, East Providence, Cranston, and Warwick. They're wildly popular with our members. And I think truly, the retirees, a lot of times, maybe might be hard of hearing. Maybe, they don't want to be waiting on hold or, waiting for someone to pick up or get a call back. And they're more, I want to talk to someone in person. That's what these Blue stores are for. They're there for member questions. They're there for education. We have nurses on staff. We offer classes. And so it's kind of a one-stop shop in multiple locations. And actually, we are opening a new location down at the Salt Pond Plaza down in the Wakefield, Narragansett area. And that will be opening up later this year. So pretty much across Rhode Island, wherever you live, you'll have access to a Blue store. But then not only are we looking at, the local Rhode Island retirees, but then how can we support your retirees across the country? And that's where we have our Medicare concierge team. They're also rated as 5-star, and they're available 6 days a week from 8 in the morning till 8 at night. And then during Medicare or annual enrollment period, they're actually available 7 days a week from 8 in the morning till 8 at night. And they're there for everything that your member needs. They flip over their Med Advantage card. There's that 1401 number. And that's another thing. So they maybe call you and say, hey, we have a question regarding our plan. My best advice is to please advise them to call concierge. And so the number is 401-277-2958. And that really is the catch-all. Our staff is local in Rhode Island. So they're working with their friends, family, and supporting all of your members. And so they are able to proactively call out. So there's a issue with a doctor's visit. Maybe something's going on with prescriptions they need help with. If they're in a Medicare Advantage plan and they need help with how do I use my OTC card, or I never got my OTC card. So I get that a lot from a lot of the administrators across towns and cities in Rhode Island. Is they'll call and say, hey, my member never got their OTC card. They never, they need to sign up for gym membership. And they're coming to you. And, that's another thing, another added, question on your list of all these other things you have to do that day. The simple answer is to direct them to our concierge team, because they will call out to a doctor's office. They'll, get in touch with a pharmacy. They'll handle all those supplemental benefits, dental questions, and that's what they're there for. So if you're running into that issue, just please make a note of that our, Medicare concierge team is there from a support function, and they do it very well. And, our members, if they physically can't go to a Blue store because they're down in Florida, they have access to our concierge team. So kind of highlighting some of the areas of our Blue stores and in connection with Blue Cross. We talk about the additional supplementals, but specifically, these fitness classes, things that we offer our members in retirement. And how do they stay connected with us? So, coming out of COVID, we offer now a big emphasis on telemedicine, web capabilities. So people are much more used to going online, providing wellness tracking, things of that nature for their own health. And then truly, like, in the bottom there, it's talking about our blue stores. It's the ability to speak, face to face, to understand someone's questions, to be able to get your questions across to someone from a Blue Cross perspective, from their support. And so those are just the elements of where we can continue to help you, but then take the burden of answering a lot of those questions and things that they might come to you for. So what I wanted to do in closing here is just go over a couple of different popular plan structures that I had mentioned, some of the benefits and structures, and then I'll have a couple of closing remarks. And then what I'm going to do is just open it up for any general questions, about Medicare, about specific plans, or any other questions that you might have in the Medicare space. So we start with that blue chip, and I had mentioned the blue chip is the HMO POS. Rhode Island residency required. You do have to have a PCP, and referrals are required. The important part of that naming convention is the HMO POS, and specifically POS or point of service. So if your member is enrolled in a blue chip plan, certainly their service area is Rhode Island. They're looking to maybe, for example, go use doctor or hospital up in Boston area. With that POS, they do have the capability of leaving the service area, going up to Boston. But there comes a co-insurance. So we pay the first 80%. The member's responsible for a 20% co-insurance there. But again, this also provides medical, prescription, embedded dental, and several other supplemental benefits. And so that's a blue chip example. Here's the prescription structure. So as I said, the prescription in these Med Advantage is already embedded. And then we get to the HealthMate. And these are the plans that I was mentioning that really kind of has opened up the conversation with a lot of the towns and cities, because prior to 2020, the only thing we could offer was blue chip. And what percentage of the population moves out of Rhode Island, post-retirement, we couldn't solve for that. And so these HealthMate plans have been very attractive for a lot of the administrators to be able to now say, oh yeah, we have that Plan 65 population that's out of state. They want access to a Med Advantage. Well, now we can provide that to them. This is our HealthMate Coast to Coast PPO2 plan, which again, first slide here, your coverage of your medical also provides you with your prescription. And there's certain things like prescription gap coverage. And so when we kind of look at the CBAs, or agreements between administration and labor, if they are offered prescription coverage, and they do have specific plans, specific benefits that are really large and important would be like a prescription gap coverage. And so what we're able to actually do now is mirror a Plan 65 from a medical perspective. If the members are on a Blue Medicare RX, we're actually able to mirror the prescription offering. So if it's a 725/40, we actually have a 515/30. We can meet or exceed that. And then we also, down to the fine details, like I said, of a prescription gap coverage, certain things like that, discussions between administration and labor, those would certainly be brought up, and we can actually validate and show that from a medical perspective, we can match, from a prescription perspective. And then above and beyond that, what's advantageous for the member, when we start talking about these conversions from Medicare supplement to Medicare Advantages, they see the additional supplementals. So maybe right now they only get medical, or they get medical and prescription. We start talking about dental, OTC, gym, vision, hearing aids, telehealth. All those are above and beyond. And so again, this is just a handful of the supplemental benefits this HealthMate plan offers. So for the member, it's great. And then specifically, we start looking at, from an administration perspective, the cost savings. And if you're currently offering a Medicare supplement, so you're Plan 65 and you're offering a Blue Medicare RX, we can match that. and we've been able to provide significant financial savings for several of the towns and cities we've worked with, both public and private entities as well. And so it's great to kind of get together. If you have any interest in saying, okay, yeah, we do have a Medicare supplement offering, I'd like to at least have the conversation, educate myself on, is there something Blue Cross could put in front of us to potentially move our members over to where they would see additional benefits at the same time provide a cost savings? Please let us know. We're happy to set up those conversations and really kind of go through what your current retirement structure membership is and potentially what we could put in place that would work for both you as the administration and labor for what they agreed upon with their retirement benefits. So I'm going to stop there. If there's any questions, happy to take those right now.
As far as questions go, folks, we can, if you want to use the function of raising your hand, we can take you off of mute, or if you have any want to put them in the chat, we could do it that way as well. Or you could just wave your hands. That'll work too. All right, any questions? No. Mark, in terms of folks maybe making an appointment and running numbers with you, is that an option?
Absolutely. And so that's the thing is, whether one, you already have, like I said, established benefit, agreement with labor that they get either medical and prescription, whatever that agreement is, please contact us. We'll set up some time. We'll do some work ahead of time to look at, your current enrollment, what you're offering, and then what we could bring to the table as a possible solution, or at least, if you're saying, okay, maybe we're not going to do a full case conversion of our current population, but we're going to open it up to allowing members to pick a Medicare Advantage if they're on a Medicare supplement. Or, for instance, a lot of groups are looking at it as maybe they're closing the Plan 65 or Medicare supplement path, but they're saying for newer retirees that, they're offering a Medicare Advantage. So that's another option. And then the third option, and I mentioned, we had talked about direct bill, is if your town or city is saying, we'd like to offer something, we're not going to do the financial investment, but we want to at least give our employees as they head to retirement an additional area of opportunity besides for just the individual Medicare market. We can certainly, discuss different plan offerings and what you could put in front of your retirees. And kind of remember that too. So whether it's you currently offer benefits or we get together and you offer something, is when they come to tell you, that, hey, I'm planning retirement, come the end of this school year, end of this calendar year, I'm going to retire. That's really kind of the area where you can bring Maddie and I in on, meaning don't feel like you have to explain the benefits and go through all that. You can simply, here's, the packet of information, but please use our name and number and please refer us to your active population as they gear up. And we can handhold them and literally, we'll educate them on the initial steps, because a lot of times they'll come to you and they don't know the first thing about what's the first step. And so we can, have that initial conversation, let them know who they need to reach out to get A and B established. And we can work hand in hand to ensure that they get set up, they get enrolled. And then on the back end, very important is that we get them off of your commercial coverage. Once they do move on to those post-retirement benefits. So yeah, absolutely. Please feel free to contact us.
Great. I do see one question in the chat from Lisa. It just says, what is an average cost to the employer for a Medicare Advantage plan for retirees?
So an average cost, what I'll say is it varies, meaning, right now, depending on, a blue chip plan could be, as low as say about $115. But we also do plans that we match Plan 65. So, if you have to contractually provide a plan that provides $0 out-of-pocket medical, and prescription. Those are obviously going to be a lot more expensive, but in comparison to if you're providing like a Medicare supplement, a Plan 65 and a Blue Medicare Rx. So it's a hard question to define the average number, but if Lisa has a question like a specific to her group, we could certainly look at what they offer and get her an answer, what she might be looking at if they were interested in either converting or even just offering a specific plan type. Because that's the other thing is there's so many variations and plan types of Blue Chip, and we have several different health mate options. And it all comes to how rich, how many co-pays are installed, things of that nature, and that really kind of will, provide a basis for premium cost.
Sure. Okay, any last questions? All right, I don't see any, but want to thank Mark and Maddie for being here with us today, and for all of you for tuning in to our workshop Wednesday. If you have any other questions, you can always see their information in the chat or reach out to me and I can put you in contact with Mark and Maddie. So thanks, folks. And you guys.
Thank you.
Take care.
Thank you, everyone.
Bye-bye.